I'm Christopher Ritchlin from the University of Rochester Medical Center, and I'm happy to present highlights from Sunday at the ACR Convergence 2020 on behalf of the Cytokine Signaling Forum. If this is your first time watching, be sure to check highlights from previous days of the Convergence. In this update, I will be providing an overview of all things cytokine signaling from Sunday's sessions. This year, there were a number of abstracts focusing on the potential of inhibitors beyond rheumatoid arthritis. I would like to highlight an interesting abstract from the pediatric rheumatology session authored by Dr. Hermione Brunner and colleagues. The authors presented 5-year data from an open-label, long-term extension study of TOFA for the treatment of patients with juvenile idiopathic arthritis. This abstract reports an interim analysis of the safety, tolerability, and efficacy of TOFA in an open-label, long-term extension study. Patients with polyarticular course JIA, juvenile psoriatic arthritis, and juvenile enthesitis-related arthritis received TOFA 5 milligrams BID or weight-based lower dose. They found that over 66 months, almost 72% of patients experienced adverse events, with 13 patients, or 5.8%, discontinuing treatment. One patient had acute uveitis at month 12. Improvements in disease activity measures the JADAS 27-CRP and physical functioning, the CHDI, were maintained to month 18. No patients achieved JIA ACR clinical remission by month 18. It's important to note that clinical efficacy was maintained over 18 months and no new safety findings were observed. Now we're turning to spondyloarthritis, including psoriatic arthritis. A number of JAK inhibitors approved for use in RA are being explored as potential treatments for SPA, or spondyloarthritis. I would like to highlight 2 abstracts from the spondyloarthritis session. The first of which is from Professor Gerd Burmester and colleagues. The authors presented an integrated analysis of the safety profile of UPA from 2 phase 3 trials. UPA has shown efficacy and safety in patients with PSA in the SELECT PSA-1 and SELECT PSA-2 trials. This is the integrated safety analysis of the placebo-controlled 24-week period of the clinical trial program. In this study, they found that the rates of treatment-emergent adverse events, serious adverse events leading to discontinuation, serious infections, and herpes zoster were similar between placebo and UPA 15 milligrams. Rates were higher in the UPA 30 milligram arm. The safety profile was consistent between UPA 15 milligrams and adalimumab, although the rate of most AEs was higher in UPA 30 milligrams compared with adalimumab. In conclusion, UPA 15 milligrams and 30 milligrams in PSA demonstrated a safety profile consistent with that in RA. Another interesting abstract from the spondyloarthritis session was from Professor Thierry Sarnace and colleagues. The authors presented a proteomic analysis following UPA treatment in ankylosing spondylitis. UPA has demonstrated efficacy in AS patients with inadequate response to NSAIDs in the SELECT Axis 1 study. This study sought to identify the pathways modulated by UPA in AS, in particular those associated with response to treatment. They reported that UPA 15 milligrams daily reduced levels of biomarkers associated with interferon, interleukin-6, T cells, inflammatory macrophages, and dendritic cells, and increased biomarkers associated with tissue repair and hematopoiesis. In silico analysis suggested that UPA exerts broad inhibitory activity on multiple JAK-dependent pathways and indirect activity on JAK1-dependent upstream pathways. Increases in biomarkers associated with tissue repair and hematopoiesis and decreases in biomarkers associated with inflammation may contribute to clinical activity of UPA in AS. Thank you for tuning in to CSS Daily Highlights. We hope it has been informative. Look out for tomorrow's edition available on our website. cytokinesignaling.com, and on YouTube at Cytokine Signaling Forum. The CSF is providing extensive coverage of the ACR Convergence 2020 on the CSF website. You can find our full abstract search and recommendations in our highlights brochure, which is available now. Look out for presentations from authors of notable papers, as well as our CME highlights of ACR course, where we go into more detail on some of the most notable abstracts presented.